right. Well, good afternoon, everyone. Just want to let folks get the opportunity to get in. Um, it's a good Friday. It's a Good Friday, not Good Friday, but it's a Good Friday here at NMQF. And I wanted to say thanks to Ashley. It's actually Ashley's homecoming at Hampton, but she's still working with us today. So happy homecoming to everybody, including especially the folks from Hampton. Our very own Anna Norton will lead today's webinar on diabetes and vaccines, building blocks to better health. Say that 5 times fast, I dare you. But with all that, I'm certain that Anna could, so I'm gonna turn it over to her and to let her lead this webinar.
Thank you. Thank you, Brandon. Hello,
Mhm.
everyone, and thank you for joining us today for today's National Minority Quality Forum's Friday webinar, Diabetes and Vaccines, Building Blocks to Better Health. My name, again, is Anna Norton, and I'm the president of NMQF's Center for Sustainable Healthcare Quality and Equity. As you may know, people living with diabetes are at an increased risk of developing serious complications from vaccine-preventable illnesses. And today, we're going to gain some perspectives from 4 valuable voices as they share facts, dispel myths, and offer ways to encourage our communities to take proactive steps through vaccinations and other management tips. I'd like to remind everyone listening in today to please use the chat box and Q&A box to share any anecdotes, resources, or questions you may have for our panelists. Our esteemed panel includes Dr. Enrique Caballero, endocrinologist at Brigham and Young Women's Hospital, Dr. Diana Isaacs, pharmacist and certified diabetes care and education specialist at Cleveland Clinic, Tasha Berry Lewis, health ministry director at New Spiritual Light Missionary Baptist Church, and Kristen Hurley, Senior Vice President of Programs, Advocacy, and Health Equity at Beyond Type 1, a patient advocacy group. Welcome, and thank you for sharing your expertise and wisdom with us today. I'd like to start with Dr. Caballero. Can you please share with us some of the building blocks to better diabetes management? What are some actions that people with diabetes can take to facilitate better outcomes?
Yes, thank you, Anna. Hello, everyone. Welcome to this webinar. I'll try to be brief because answering that question could take the full hour about what patients with diabetes need to do. And we're focusing today on the importance of vaccines. So I'll introduce that in a moment. But I would start by saying that obviously diabetes is a chronic condition that unfortunately cannot be cured at the present time, but can be well controlled. And in order to achieve the usual targets in terms of diabetes control, people need to work on their lifestyle. And, we all recognize that a good meal plan and regular physical activity continue to be the key elements in the management of diabetes, as well as obviously taking the medications. And it depends whether people have type 1 or type 2 diabetes. Type 1 diabetes usually requires insulin therapy. Type 2 diabetes may require it as well, but there's many different classes of medications. And obviously the regular checkup or the constant measurement of their blood sugars, whether that's with the capillary glucose testing or now with the continuous glucose monitors, for example. So there's a lot of different things that people with diabetes need to do. But I think that the important piece for the conversation today is that uncontrolled diabetes, and that means when the blood sugars are elevated in most people, that could increase the risk of severe infections. Not necessarily that people with diabetes are more likely to get the virus in their system. That can happen to anybody. But the consequences of having the virus or any virus in the body could be very different. If people with diabetes do not have their diabetes under good control, the chance of having severe infections is much higher. And I think this is something that people need to remember, that it's not just by having diabetes that people may actually get worse. It's really if diabetes is not well controlled. And remember that now when we talk about diabetes, we don't talk about just blood sugars alone anymore. Diabetes, in particular type 2 diabetes, comes with being overweight or having obesity, comes with high blood pressure, with high cholesterol, many times with cardiovascular disease, kidney disease. And the more comorbidities people have, the higher the risk of these severe infections that can happen in a person with diabetes.
Thank you. And actually, that leads me into my next question when you mentioned comorbidities and complications that sometimes come with diabetes. So, can you provide insights on how the communities of color or how communities of colors may have bigger burdens because of the comorbidities, as well as hospitalization rates, and how some of these outcomes can be prevented through vaccination?
Yeah, well, of course, we all have witnessed, unfortunately, the fact that people from these communities, we're talking about the Black community, the Latino, Hispanic community, and others, have had historically higher rates of chronic conditions, including type 2 diabetes, for example, and the comorbidities that you were alluding to, Anna. So that's not new. But for example, during the recent COVID-19 pandemic, it was very clear that they were the ones that were more susceptible to develop severe infections. They had higher hospitalization rates and unfortunately higher mortality rates than other groups. And what that just unmasked is that these are populations that are struggling more than others in achieving these common targets. And that has been well demonstrated throughout the country in different studies like the National Health and Nutrition Examination Survey and others. And I guess the key question is why, and that's obviously a complex answer, but I think it's a multiplicity of things. It has to do with the healthcare system that unfortunately sometimes does not provide the right support to our communities. It has to do with, of course, patients having challenges and barriers that are more common than in other populations from the socioeconomic perspective, access to some of the correct foods and lack of support, many other things. But also we as healthcare professional or providers may not actually be doing a good job in helping our community. So I think it's something that I always think about these triad of the healthcare system, the patients, and the healthcare providers. And I think that's where the vaccination becomes even more important for these populations, because this is an easy way to reduce the risk of developing severe infection. So this is something that is recommended for everyone with diabetes, but in particular to those individuals that have a much higher risk. And in this case, our communities have a much higher risk of developing this condition. So I think that one of the messages from today for everybody is to remember that vaccination is a great way, an easy way to reduce the risk of these important conditions.
Thank you. And I was actually going to ask you what takeaway you would like to offer, and you had just answered that for me. So thank you very much. One last thought before we move on to our next speaker. And again, I'd like to remind everyone listening in, if you have any questions, please put them in the Q&A. If you would like any more information, if you have any resources to share, please share them in the chat box. We would love those and greatly appreciate them. But the last question I think that I have to ask is a little bit on a broader scale. We learned so much from the COVID pandemic and then what came after with vaccination. What can we do differently, do you think, now that we know a little bit more about handling sort of these bigger global scale issues when it comes to infections? What what can we do differently with future public health challenges, especially for people that live with diabetes in minoritized communities?
Yeah, well, what we found was that we were not prepared for sure to face this enormous challenge, and that it was really these populations, the ones that had the most significant challenge. And they, as I said earlier, ended up being in the hospital more frequently and unfortunately dying from severe disease. So we can't just go back and do what we were doing before. We need to learn from this experience. And I think this is a call for action. What do we need to do? I think that we need to provide more support to our communities to improve the care that they are receiving for all these chronic conditions, diabetes, cardiovascular disease, renal disease, hypertension, etc. That's easy, obviously, to say, very difficult to implement, but we need to learn from this experience. Just going back to what we were doing before is not going to solve the problem, because we know that things were not working well. So for example, I'm very enthusiastic about new approaches for diabetes care. For example, I think that we learned that people don't necessarily need to come to the hospital in order to be in touch with them. So no, I'm a fan, for example, of virtual communications, maybe telemedicine. And again, I know that there's this digital divide and sometimes it's not accessible for everybody, but seeing patients for 10, 15 minutes every 4 months is not going to help most of our patients. So the healthcare system needs to embrace different approaches. I am also a fan of not just the doctor being the one in charge of all these conversations with patients. We need a team. We need a multidisciplinary team. And here, for example, we have Diana, who has, the role of that person that can actually really work so closely with patients. And, many other people, educators and others that can really get together to provide support. Final point is, for example, community health workers, patient navigators, people that are members of the community can work very closely with patients in order to try to optimize the care that they are receiving. Because in the end, if we try to help them get better control of diabetes and other conditions, they're going to be better prepared for future disasters. And I'm sorry, but I have to say it's going to happen again at some point, hopefully not soon. But when that happens, hopefully we will be better prepared, because certainly we were not ready during this huge, devastating pandemic.
Wow. Thank you. Thank you so much, Dr. Caballero. As always, we appreciate your expertise, your sharing of information. And I'd love for you to stay on, because I have a feeling that there's going to be a lot of conversation between our panelists, just based on what we're chatting about today. But now, and Dr. Caballero alluded to her, I'd like to introduce Dr. Isaacs. Dr. Isaacs, I mentioned, is both a diabetes care and education specialist and a pharmacist. So my first question to you is, what are some vaccines that are necessary to the health of people with diabetes? We haven't mentioned any specific ones really yet, except for flu, but what other ones do you feel or do you see are necessary?
Yeah, well, I also want to thank you for the invitation and thank everyone for attending this webinar on this really important topic. So yeah, definitely flu every year is recommended for people with diabetes. We also have the COVID vaccines too, and those are definitely recommended as well. By getting that vaccine, while it may not completely prevent ever getting COVID, we know that it reduces complications with COVID and often make the cases just much more mild. So that's really important. But there's also actually a bunch of other vaccines too that are recommended from our guidelines. So another big one are the vaccines. And there's different recommendations, people under 65 and then over 65 getting additional vaccination, but that's really important for prevention of pneumonia. And then there's also others too, like the herpes zoster or the shingles vaccine, as well as like tetanus, diphtheria, pertussis, Tdap, getting one at least every 10 years, or for women that are pregnant, we recommend one every pregnancy, so those antibodies can go to the baby as well. So in generally, a lot of the vaccines that are recommended for people without diabetes are also strongly, they're recommended for people with diabetes as well, like same childhood vaccines and those types.
Yes, and because it is the season for vaccines, what other illnesses or infections are we seeing in the community, or what might be heightened this season?
Yeah, I mean, there's definitely there's RSV as well, which now we have a vaccine for that too. And yeah, this is just kind of that cold flu season. This is when they recommend to get the flu vaccine. This is really like the optimal time, so that when you get together with family over Thanksgiving and the holidays, that you are protected where that occurs. Likely just kind of with the cold weather coming in, and we just see that there are more of these types of respiratory illnesses. And so getting these vaccines just protects you, and hopefully so you can have happy, healthy time with family and friends and not have to worry about being sick.
Yeah, but that being said, I do wonder, have you seen, as a pharmacist, as an educator, have you seen any resistance to this proactive measure?
Yeah, there's so much resistance. So I think part of it is that, like, these are injections and like it's never fun. Like oh yeah, sign me up, like give me a shot in my arm. And so automatically we're dealing with that. But I think there's also just some misinformation about the benefits, about needing it. You know, some people do get concerned about potential side effects, which are generally very mild. Most of these, they're not live vaccines, so they're very safe. They've been studied in large populations of people. But unfortunately, we see some misinformation online about potential side effects and the cases of where someone happened to get the flu and the vaccine, maybe they got it the same day, but they were already getting the flu. And so they associate the vaccine gave them the flu, which we know, I mean, that's false. The vaccines do not cause the conditions that they're preventing. But that's some of the misinformation out there that we're just trying to educate people on so that they don't have this hesitancy about getting the vaccine.
Right. And what about working in minoritized communities? Do you see some of this hesitancy because of these myths?
Yeah, I find that sometimes there's even more just concern about like trusting the vaccine process and the safety of it and everything. And so I think we really need to ramp up our education efforts as well as like making sure that they're very tailored to people and addressing their specific concerns and having a conversation. Like it's not enough to just give someone a leaflet and be like, this is what it does. Like it's about asking the person, what are your specific concerns? And can we have a conversation about it? And can I explain to you how this works and why we think it's beneficial for you? I think just those tailored, individualized interventions are really important.
Thank you. Yeah, I just was thinking about these misconceptions, but also other barriers. And I don't know if you've seen these in clinic, barriers to cost. Some of the vaccines do have a cost associated with them, or accessibility to even get to a location where vaccines are being offered. You mentioned lack of education, which is something that I was going to bring up, but now I don't really need to. But those two things, just the cost and the accessibility of the vaccines. Have you seen any challenges there?
Yeah, absolutely. So in terms of, so it's interesting, we heard from Dr. Caballero about, virtual care and how that's made it easier to access, to see patients and make it more convenient, but you can't give a vaccine virtually. So we have to get patients into clinic or we have to come to them. We have to make it easy to reach them. And so I think like the first thing is definitely clinics need to be set up that when patients do come, that we make it really easy. We can offer it right then and there. And that's having also support staff because often the visits are really short. And so you need to have that kind of support staff that is able to offer it, able to deliver it. So it is easy when people are there. But that's really not enough because they may go all flu season and not actually go into the doctor's office. And so that's where we need to offer more accessibility. Fortunately, many pharmacies are offering vaccines and it's pretty easy to make an appointment. And often that's more convenient because most people live near a pharmacy. So that's certainly one strategy. But I think also like going to the people, like if you can offer it in a location where people are already at, like kind of thinking out box? Is there a concert? Can you go to a barber shop? Like, can you just go to a place where people already at and offer this and just make it easy where it's like, even if they were kind of on the fence, they're like, okay, you're right here, I'll just do it. And to your point on the cost, certainly that is important too. We are seeing, because these are preventative measures, we are seeing, I think, great coverage for things like COVID and things like the flu vaccine. That is unfortunately not always true of every single vaccine. And so certainly there needs to be more efforts just to make sure that these are all covered by insurance and that the person is not having to get stuck with a large copay or a bill for the vaccine, because that would be a huge bill.
Wow, yeah, thank you. And actually, we have a question, and I'm gonna raise it to you, Dr. Isaacs, because you did mention pregnant women living with diabetes. So the question is, what kinds of approaches have been taken to target pregnant people with gestational diabetes?
Yeah, well, so we are seeing a lot more gestational diabetes. And so actually true gestational diabetes is diagnosed weeks 24 to 28 of pregnancy. But actually a lot of people are also living with undiagnosed type 2 diabetes or prediabetes that may not get discovered until they're actually pregnant. And so one of the approaches is to not wait till week 24 to screen a person, to actually screen people that might be at higher risk, or some would argue just get an A1C test on everyone, to, if someone does actually have diabetes that they didn't detect, to check that earlier. And then in terms of if we find out that they have diabetes, they have gestational diabetes or pre-existing diabetes, we monitor, and monitoring glucose levels in pregnancy is so important, as well as getting the necessary vaccines like the flu vaccine, the Tdap vaccine. And so that's a very important population that we're seeing so much.
Right. Thank you. Thank you for that. Do you have a takeaway for our listeners today?
Well, managing diabetes is a lot. Like, I kudos to all of you, because there's a lot that the healthcare team, ask you to do, from monitoring your sugars to trying to eat healthy, incorporating physical activity. Now we're saying you should get these vaccines. So it's a lot. And so try not to do it alone. It's so important to have a support system, and also make sure you've got a good healthcare team behind you. So we on our team, like, we've got dietitians and pharmacists, we have social workers, psychologists, the physicians, nurse practitioners. And so make sure you advocate for yourself, that you've got a team, and ask to have that team, because you deserve that.
Thank you. Thank you so much. And now,
Anna, may I
yes.
interrupt for 1 second? Just add one thing about the gestational diabetes piece, because I think that for everybody in the audience may be important to remember that women with gestational diabetes usually go back to having normal blood sugars after the pregnancy ends, but this is a very high risk group to develop type 2 diabetes in the future. So data show that probably 50%, if not more, of people who had gestational diabetes will develop type 2 diabetes in the next 10 to 15 years. So this is a population in whom preventive measures are really encouraged. This is exactly one of the groups that we studied, for example, in the diabetes prevention program. And I've been very interested in type 2 diabetes prevention for years. And that's why I always take the opportunity to remind people that, if someone had gestational diabetes, that's an ideal person to work with lifestyle modification and try to prevent the development of type 2 diabetes. I mean, for example, we have in the DPP, we use metformin also, that may be particularly beneficial in this group. But I think it's just to remember that it's a high-risk group for type 2 diabetes in the future.
Yeah, absolutely. That's something to note, and sometimes overlooked by healthcare teams, overlooked by the mother, who is no longer thinking about gestational diabetes, but is thinking about the care of a child.
That's right.
And so that is very, very important. And I think going back to Dr. Isaac's point about advocating and finding a good healthcare team, that is something that should also be part of the conversation after childbirth, with gestational diabetes, or any diabetes, actually. Just to continue to focus on the management of the disease. Now I would actually like to delve into those working with community-based outreach. Dr. Isaacs mentioned some really great approaches. She talked about churches, and she talked about hair salons, and she talked about concerts and vaccinations. And I would love to share, before I introduce our next speaker, that the SHC at NMQF does have a hair wellness program where stylists and barbers do vaccination clinics. They call it Shots at the Shop. And so community members can come in and get vaccinations at their stylist shop. It's a very, very easy way to do that. And you're there for a while, so you can also receive education from your stylist. So if anyone is interested in our Hair Wellness Warrior program, please let us know, and we can get you more information. Or we can just drop some information into the chat box, so you can learn more about that. The other community-based program that we have that we're going to talk about now is our Faith Health Alliance, which is a group of churches that work on community-based efforts with community health workers, like Dr. Caballero talked about, to really educate about different diseases One of our big programs is diabetes. Another one is vaccinations. We actually have a vaccination clinic coming up next week in the Washington, D.C. area. It's on November 2nd at Purity Baptist Church. And so they will be offering flu and COVID vaccines to congregation members. Many of our churches do flu vaccine clinics and other vaccination clinics after services. And so that is a wonderful way to get community involved through education and action. So now I would like to have Tasha Berry Lewis chat with us a little bit about the work that she does through the church and the health ministry where she's located in the Chicago area. So Tasha, welcome. And my first question to you is, how do you engage the community to get vaccinated, especially people that live with diabetes?
Thank you for having me today. What I found works for what I do is to bring the clinic to the church. Just like Dr. Isaacs and Dr. C was saying earlier, I think people will be more susceptible to getting the vaccines if you bring it to them. They trust the church, they trust the pastors, they trust what we're bringing to them. So they are more aware of what's going on and they will get the shots if we show up with the information in hand and the shots available for them to take.
At your churches, Tasha, do you have a strategy that you use to gear education and vaccination resources aside from the leaflet, the pamphlet?
Well, what I think the first thing we need to do is find out what the congregation needs, what the community needs. So once we talk to everyone and we ask them, what are they looking for? Like with people with diabetes, we ask the questions and then we try and gear our educational seminars towards that to help them get the information that they need so that they can be aware of what is happening in the communities and what's happening with the doctors and the nurses and the pharmacists. If we can bring it to them, that will help out a lot.
Yeah, great. Why do you think that this is valuable to the community to bring them to the church itself?
The knowledge. I mean, I think we need to ensure, that everyone's aware, making sure that the information is correct, and letting them know that it is correct. We don't want what happened years ago to be a deterrence for them not receiving the vaccine. We just want to make sure that we promote the health and wellness of the congregation so they can be around their families. And I believe Dr. Isaacs or Dr. C said it earlier, so that they can be with their families and be around their families. So we need to make sure the information is out there and they are getting the correct information, not just secondhand or third-hand information from someone that's not reporting it correctly.
Have you seen a change in vaccination adherence through the ministry? Have you seen more people getting vaccinations?
When we bring the vaccines to the churches and to the community, we do see more people just ready to take the shot, because if they see someone else doing it, it's more likely they'll say, oh, it's not that bad, I guess I should do it too, and it may help me out in the long run. So yeah, I do see that. I do.
Yeah, that's excellent. So kind of this like strength by numbers and a
Yes.
support system, right? That
Yes.
is valuable.
It's
Do you have any upcoming projects that are happening in Chicago to further the education for people that live with diabetes? And if so, can you share about them?
I certainly do. Actually, as a part of my doctoral program, next Saturday at First Unity Baptist Church, I'm having a diabetes awareness seminar. And I just got word that I have gotten an endocrinologist, I have a primary care physician, a nephrologist, a nurse practitioner, and a pharmacist. I also have Bruce from Dexcom, one of the companies that supplies the glucose monitors, continuous glucose monitors. He'll be there as well. So all are welcome. If you need a flyer, just send something to Anna. I think I sent it to you yesterday. So that's our next event that's coming up in Chicago.
That's great. And Tasha, if you wouldn't mind putting in the chat just the location, and you know, the day and the time, so that the listeners can see that as well. And if they're interested in attending, you know, they can feel free to go, right? It's a community event, it's open to the public.
Absolutely.
And the main question is, will you be offering vaccines?
I will have flu vouchers so that you can go to Walgreens and get your flu shot for the season. So yeah, I will have those.
So that's wonderful when we talk about community-based efforts, community health workers, what our Faith Health Alliance members are doing in the community, what is happening with our hair wellness warriors. I saw that there's a question about the shots at the shop in the Q&A, so we're going to share some information about that so you can learn. And these are in person, right? In-person outreach
Yes.
programs. So what I'd like to move into is talking about the online community a little bit. And I'd like to welcome Christian from Beyond Type 1. Her work is mostly online. And so we would love to hear how the online community might differ in ways of approach and adherence when it comes to vaccines and people living with diabetes. So welcome, Christian.
Hey, Anna, thank you so much for having me. Well, gosh, so how does it differ online in general? I would say that, you know, our mission at Beyond Type 1 is to help people living with diabetes to survive and thrive. You know, we do this from a myriad of programs, global awareness campaigns, our digital platforms, our social media spaces, and our peer support communities. I think what we're finding, particularly with vaccines, we really focus on providing relatable information that answers the questions that we know that our community is seeking. You know, we have a very large digital following, about 5 million people engage with us in our social spaces. And so you can imagine we hear a lot of the conversation, as you said, that's happening online about what people might be concerned about and challenged with. And so we just try to counter that information as it's coming on our comments and things in our apps and things of that nature with accurate information, as well as elevating the stories of people living with diabetes to really ensure that we are countering any misinformation that people are sharing online with things that they can trust so that they can make a really empowered decision. Some of our websites that we do that on is our Beyond Type 1 and beyondtype2.org websites. And on these spaces, we provide guides, articles, as I said, personal testimonials, really highlighting those truths about flu shots, as well as COVID vaccine and other vaccines in general, and trying to sometimes burst those myths that people continue to share online and try to elevate that as well. We also have, oh, go ahead.
No, go on, please go on.
Yeah, we also have our peer support community that is found in our apps, and you can also access these communities online for both our Beyond Type 1 and Beyond Type 2 audience. And so these are really amazing opportunities for people to really, whatever question you have or any topic that is concerning you, you can go to our app community and just search for that, you know, hashtag vaccines, or, you know, go in there and use the search function, and you'll have the opportunity to see. I went and checked myself, and, you know, as soon as you put that in the search function, you see what people are saying, people who are living with diabetes, the concerns, you know, that they might be facing. And, you know, people actually are supporting one another and saying, you know, this has been my experience. I'm really recommending that everybody, you know, let's take care of ourselves and get vaccinated. And so those peer communities are very powerful online because, again, there's just something about individuals living with diabetes being able to have that connection and that trust with one another and be able to kind of share how their lived experience is helping them to thrive with diabetes.
Yeah, I think that's wonderful that you have an app. If you could share that in the chat, and maybe those that are interested in receiving a little bit additional support from the diabetes online community, they can check that out. That would be wonderful. Um, as far as hesitancy, and misinformation, you touched a little bit about that, but how in the online space are you able to better manage the misinformation that sometimes go out? I'm curious to hear how that is, because we get so much information from the online space, from professionals, from clinicians, from practitioners, and then from patients themselves, and so everyone is an expert online. And
Everyone's
so so I think it's a good point to bring up,
Mhm.
to figure out how to weed through some of the misinformation.
Yeah, I mean, I think that from our perspective, I mean, maybe I'm starting a little broader here, but I think as an advocacy organization, like we really feel that we have a responsibility to do that, right? To make sure that people are empowered with the right kind of information. And so you can't necessarily stop people from posting, right? I mean, we don't turn off comments on our posts. We allow people to share everything that they need to share. But again, we really feel that responsibility as an advocacy organization to make sure that people feel empowered with the right content and information. And so we root all of the information that we are sharing in, very trusted sources like, the CDC, the American Diabetes Association, National Minority Quality Forum. We ensure that anything that we are sharing has been, verified, and so that we are sharing information that people can trust and depend on. But we also work really hard to root our work in, again, the lived experience by way of education, right? So we want people to share, but how can we leverage those stories to encourage people to leverage the verified information that we're sharing to maybe get people to listen to it and maybe a little bit of a different way. And one example I'll share, we had a lot of articles and resources that went out, of course, during COVID. This was a time of all kinds of misinformation and things going back and forth. And, we had some articles about COVID-19 and the pandemic and disparities and, why are we seeing these disparities? But as I was looking back through some of those articles, we shared a story in which we had been, in the article talking about vaccine adoption rates and trying to kind of close some of those gaps. But we shared a story from an African-American woman. She's a global diabetes patient advocate. Many people might know her name is Felissa DeRose. And, she talked about how she wanted to get vaccinated. She at that time lived with type 2 diabetes, but she had so many concerns about getting vaccinated. She couldn't help but be plagued by like the history of the medical system and Tuskegee and all of these things. And it was like always in the back of her mind. So she didn't want to be first. Like, she's like, I'm not going to be going down there first and getting vaccinated. But then she talked about her personal experience with diabetes and how she'd been diagnosed with type 2. And then at some point, the doctor had told her that she had an electrolyte imbalance and that, that was going on. And so she, being an empowered person with diabetes, asked for an antibody test and was denied multiple times over many, many years. An antibody test, she'd come back again and ask for this test. And she reported how very oftentimes her practitioner would seem like almost upset, that she's like taking this action and making this request based on what she knows about her body. So long story short, she did end up getting diagnosed with type 1 diabetes. She went misdiagnosed for many, many, many years. Unfortunately, she got diagnosed in DKA and her life was on the line and almost lost her life to this. And so I share that story because I think these things are not disconnected, right? When we talk to our community members about getting vaccinated, this is the history, the lived experience from which they're coming from. And I'll say we hear this story all the time at Beyond Type 1. Like, this same type of story is very, very common. And so we really just, combating misinformation for us, it's just all about arming people with the right information, elevating stories like this so that people will listen to what is happening to individuals living with diabetes, giving them tools and resources in an easily accessible space like online and in digital spaces, just really all with the goal of ensuring that, they can get the right care and that they really have the opportunity to access, thriving with diabetes, as we so often say.
Thank you. Thank you for sharing that story, because it does bring it home, I think, to many, to hear these personal stories, these personal anecdotes about patient empowerment, about advocating for oneself, and for having for putting together a healthcare team that listens and that is also proactive with health. I didn't ask you, Tasha, and I'll come back to you and ask you, but Kristen, do you have a takeaway for today's conversation?
I think, actually just what I just said. I have spent, I don't know, 15, 20 years working in health equity in communities. And there is all the things that we're working so hard to do to remove barriers, to improve access. That's going to continue, but people need to empower themselves with information. There is so much out there, and so many fabulous organizations and clinicians and federally qualified health centers out there who want to help. But individuals have to kind of take that responsibility, right? To empower themselves and to not be afraid of asking those questions and continuing to, seek the best care for themselves, because, until we fix it, I think that's the only thing that we can really continue to talk about. And so that's one of the things we focus on, just really empowering our community and making sure that people have what they need to be advocates for themselves.
Yeah, thank you very, very much. And Tasha, I didn't ask you, but I'm asking now, do you have a takeaway
I
from
think
the conversations of
I
today?
think Kristen said it all. I mean, we need to empower ourselves to ensure that we're getting the information we need, and we are in enabling ourselves to ask the questions that need to be asked of our doctors and our pharmacists and everyone else that's on our team.
Yeah, that's great advice for everyone listening. I will remind you, if you have any questions for our panelists about any of the programs we've talked about today, please put them in the Q&A. We do have a request, and that is for contact information for our panelists. So if you're a comfortable panelist, just drop your contact information, email, or website, or any way that our listeners today can reach out to you. That would be great. Um, does anyone have anything that that they would like to add? Speaking amongst each other, our four panelists, Dr. Isaacs, Dr. Caballero, Tasha, and Christian, just to reiterate what one said a little bit more, highlight something that you heard that resonated with you. Now is the time. Oh, you're muted, Dr. Caballero.
Sorry. I can say something, and I am sure that everybody else can pitch in, because I think that one of the key challenges that we have in this system is how to support all this community-based activity. So, for example, as I was listening to Tasha and all the work that is being done, what you mentioned, Anna, and what Christian is doing, I mean, this is music to our ears, for Diane and I, and as regular, healthcare professionals that see patients day in and day out. We need more people that can be part of our teams to go out in the community to provide the right information, whether these are in-person or online activities. But the problem is that our healthcare system, or systems in general, do not provide support for these activities. So I don't know, Tasha, for example, how is your program funded? I am sure that it's the challenge of getting support, and I'm sure that there's volunteers and maybe there's funding here and there, but there's nothing sustainable. And I think that that's one of the challenges that we have in our healthcare system, that there's really no emphasis in supporting community-based interventions. I always think that the best way to get their attention and support is to demonstrate outcomes. For example, if we can, in any of these programs, demonstrate that there is, in fact, an improvement in any of the metrics that are usually followed, less hospitalization, better control, etc. But ultimately, I think my experience over the years is if we can demonstrate that there is a financial benefit for this system, that's when people will hear this type of conversation. Otherwise, it ends up, oh, great, fantastic program, going to the community, talk to a lot of people, good luck, that's great. But it's like you're alone, and I'm sure that many people in the audience may be just saying, this sounds great, but what can I do? in my own environment, in my own setting. But anyway, I don't know, Tasha, Diana, and Christian, if you
Well,
want to.
luckily for me, I've partnered with National Minority Equality, and they do give stipends for some of these events that we hold. And event next Saturday, I'm giving anyone who finishes the survey. So considering that this is part of my doctoral program, I'm gonna have people complete a survey, and for that survey, I'm gonna give them a $10 gift card for Walmart. It's not much, but I guess it's a little enticing for some people to come out and do these community, attend these community events. I think it's hard because you don't have a lot of resources to host these events, and that's probably why you don't see very many of them. I think a lot of us have to just come together and just do as many as we can on not just diabetes, but other topics to help the community, just get that information put out there. Kirsten,
Yeah,
something? Oh, no, go ahead, Doc.
oh, sorry. I was just going to say, I agree. I mean, I think that there's a lot of community efforts, but we need so many more. I know, Cleveland Clinic, for example, we're a nonprofit, so we should be giving back to the community. And we do, we have different, health outreach events, but we should do more. And one of the things they do offer all the employees, it's not a ton, but it's like 4 hours paid time to volunteer to do some type of, volunteer health outreach. So, I mean, when you add up like 50 or 60,000 employees, that does add up to a lot of hours. So I think we just need to coordinate our efforts better. I'm part of a lot of different organizations, like a lot of diabetes organizations and endocrinology and pharmacy organizations. And I think we just need to work better together to coordinate these efforts to really get into the community and make a difference, because people, we want to help. Like, people that work in healthcare, want to help. Yeah, we're stretched, but we want, that's why we went into healthcare. We want to help. So I think we on our end need to get more organized. And then for the people living with diabetes, just advocate, because healthcare is never going to be perfect. And you're always going to have to advocate for yourself, ask about everything, keep pushing, and hopefully together we will make things better.
Mm-hmm.
I can add too. I spent many years working in Southeastern Michigan, working with faith communities and partners. And there's a lot of really interesting networks, like with the work that you're doing. There's a lot of faith networks that are backed by health systems, which I would love to see that grow. So there are systems here locally that have whole networks of churches, and they provide them with, say, software to actually track and monitor the blood pressure screenings or the A1C checks that they're doing during services. They provide that for them. They provide, some training and education. So there are some really great programs that, those, if you're a nurse and you're in a church and you're looking to participate, obviously working with Anna's group, but also there's so many other groups that have resources that can support, and also just aligning with other partners. I feel like all of us as advocacy organizations have some form of program or goals that we're trying to implement, and would love to work with churches and community-based organizations. And so as we talk about people being empowered, if we haven't reach out to these advocacy organizations and ask for support, because I feel like so often there's resources available that can help us sustain some of this work in communities. And I'll add just a couple things that we're trying to do to help. That is, we do have a new program called Beyond Barriers that we're launching in Chicago and in Miami and in Detroit. And so we're going to be doing some mini grants, for some of our partners that we will identify. And that should provide some support on the ground to be able to have some events like this, health fairs, how we want to be able to elevate peer-to-peer programming, self-management, being able to help people get access to self-management programs. And so we'll be doing some of that work as well. And we also have an ambassador program where people can sign up as an ambassador through our See the Signs campaign, and we send out free resources to any community partner who would like it. And so if you want warning posters that highlight the warning signs of diabetes, or educational programs that help you to share with your community the basics about what is diabetes, and just, again, add that safety net in your community to ensure that people have that baseline of information. So we have some of those resources that can at least supplement, organizations who want to do community-based programming, but might not have the educational resources or the materials to do so. So we can help in that avenue as well.
Well, thank you all very much for sharing additional information and insights, and building upon what each of you have talked about the last hour. Very valuable information. We don't have any more questions in the Q&A, so I'm going to begin to wrap up, but I'd like to thank Dr. Caballero, Dr. Isaacs, Tasha, and Christian for their time today, and for the stories that they shared, and for the messages that they're imparting on each of us. We're gearing up for National Diabetes Awareness Month and this ongoing flu season. So these conversations have been very, very valuable. We will have a recording of this webinar available on our YouTube channel in the next few weeks. So if there are any points that you missed, or that you want to listen to again, or that you want to share with others in your community, you will be able to do that. We hope that you have gained additional resources that you can share with our panelists today that have graciously shared their contact information, as well as National Minority Quality Forum. And on behalf of NMQF and the Center of Sustainable Healthcare Quality and Equity, thank you for joining us. We'll see you at our next webinar. Bye.
Thank you.
Thank you for having us. Thank you.